In this presentation, we'll talk about what you can expect in Associate Degree Nursing Transition clinical classes. Welcome to the clinical portion of your nursing education. Students who have a plan to manage responsibilities and sequester serious study time have made good preparation for success. You're learning the necessary skills for one of the most highly regarded careers in the world. Nursing is embodied in Dr. King's quote, "Every day presents an opportunity to make a difference in someone's life." In this segment of the presentation, we will discuss the varying times of day classes are offered, what it means to be a nurse, the great risk of overcommitting, what a nursing student can expect for time commitments, clinical preparation, and clinical locations, and what nursing instructors expect of students. To be a nurse is a calling that's difficult to describe in words. Who can say why a person would want to do a nurse's work? But those who do will tell you there's nothing as fulfilling or rewarding. Nurses stay by the side of those they serve through the worst times and celebrate with patients and families in the best times. There's an intimacy nurses and patients share which is understood. The essence of nursing is an unconditional love for mankind. To be called a nurse is an honor, a profession of the highest realm. Learning and successfully completing nursing will be unlike anything you've done before. It requires a special set of skills in many areas, including critical thinking. When students take this 2-credit-hour class, in the week before clinical classes begin, evidence shows they are more successful. It really works. When a student begins nursing clinical courses in August or fall semester, they will have the choice of attending later in the day. But, for example, surgery, children's clinics, and OB clinics are available only during the morning, so students must expect to have flexibility. Students enrolled in the Transition ADN program have 4 semesters, or approximately 16 months, of clinical coursework to successfully complete in order to graduate from the program and apply for the NCLEX RN exam. The clinical courses are sequential and cannot be compressed into any shorter period of time. When a student begins nursing clinical courses in January or the spring semester, they will have the choice of attending early in the day. Many clinical sites are available to students only during the day, so your scheduled clinical hours should cover time-sensitive areas like surgery, children's clinics, and OB clinics. A student will hear this term mentioned in every nursing course until graduation. It involves critical thinking, assessment, nursing diagnosis, planning, implementation, and evaluation of nursing care. Each sequential course builds on the knowledge, skills, and critical thinking a student is gaining, becoming more complex and involved with each semester. Memorizing is what you've done all your lives to pass tests. An example would be, what is your blood pressure? Understanding is knowing how the facts you learned work together, like, what does 120/80 mean, and is that okay? Application is using that understanding to solve a problem. For instance, should I give the blood pressure medication? How and when? Nursing school is very demanding. Students have a hard time believing this slide until they actually enter clinical courses. Then sometimes it's too late. A student who doesn't have enough time to really study will spend the rest of the semester playing catch-up for a failing grade. It takes at least 3 hours of study for each credit hour of class. The students we see at most risk of failing a class are the ones who add too much to their nursing school schedule. Some students try to retain a full-time job or combine nursing with other courses. We include this information for your benefit. If you know ahead of time that you're putting yourself at risk, then you can plan for management of your time and family responsibilities. Online modules may take more time because they have to be completed with pre- and post-testing to learn skills. Study habits may need to be altered to fit new content. The reading is more difficult with unfamiliar terms and content. Some relearning of areas like math may be needed for medication and math calculations. Opportunities for unique learning may be made available outside of normal class time or lab hours. Students are required to go to the clinical facility the night before the clinical visit to receive their patient assignment. Students should expect to spend time in preparation for instructor discussion and questioning on patient charting, being familiar with pathophysiology and treatment, and a plan for nursing care for the clinical day. These represent sample clinical skills taught or reviewed in Nursing 201. These skills will be taught in the lab or classroom prior to going to the clinical site. Students have found it helpful to review skills checkoffs in the text and video presentations on the nursing lab computers. Once students receive their patient assignment, they will study various conditions, drugs, and procedures. Your clinical instructor will ask about your knowledge of the condition of your patients to make sure you've prepared for this interaction. Students are responsible for being familiar with patient care, medications, and treatments. This is a typical schedule for Nursing 220, sometimes called OB and Peds. You will study acute and chronic illnesses, health maintenance for patients in childbearing years and all stages of childhood and adolescence. Normal aspects of care and growth and development are also covered in this course. A variety of community sites are chosen to provide the student with an opportunity to incorporate theories of human development, growth, birthing, behavior, teaching and learning, and family constellations into client care delivery while utilizing the nursing process. This is the schedule you can expect in your last semester. Each of these classes is a 7-week class, so a student takes both classes in their final semester. Nursing 221, Advanced Nursing, expands the application of the nursing process, critical thinking, planning, implementation, and evaluation of nursing care, in the care of persons throughout the lifespan who are experiencing trauma, burns, respiratory failure, and chronic neurological conditions. Also, the student is provided the knowledge to lead and manage the healthcare team, utilizing appropriate delegation and evidence-based nursing. Students work the same schedule as their assigned clinical preceptor. Nursing 214, Mental Health Nursing, facilitates the utilization of the nursing process to assist in meeting the needs of patients with common mental health problems. Focus is on the dynamics of human behavior ranging from normal to extreme. Emphasis is on the therapeutic use of self. You're entering one of the most respected and trusted professions. We expect you to conduct yourself as a professional. That means arriving on time, even if you had trouble sleeping the night before. Being prepared by pre-reading content before class. Making a sincere effort by participating in class to understand and clarify. And taking responsibility for your actions and your learning. This is a quote from one of your instructors. I want the transition students to come rested, eager to learn, and curious to discover what they have to become to call themselves RN. I want them to be open to new ideas and ways to learn. They must be willing to take responsibility for their own learning and to ask when they need help. They should not settle when they don't understand. I want to see excitement, not boredom. I want to hear, can I practice the skills on other days than Tuesday? Or, how would that look if my patient had that problem? Not, do I have to stay all 5 hours? Or, is that on the test? This is from Dr. Harper, lead teacher for Nursing 201. A student who is self-disciplined stays on task as needed and manages time to focus on priorities. A student who is sensitive to diversity expresses appreciation of human differences related to values, culture, and personality. A student who is reflective and self-corrective carefully considers meaning of data and interpersonal interactions, asks for feedback, corrects own thinking, is alert to potential errors by self and others, and finds ways to avoid future mistakes. A student who is courageous stands up for beliefs, advocates for others, and doesn't hide from challenges. A student who is flexible changes approaches as needed to get the best results. A student who is empathetic listens well and shows ability to imagine others' feelings and difficulties. Student preparation helps make the sacrifices easier to manage for students and their families. The rewards are great. This student's quote is, "When students share their experience, they say things like this. In Nursing 201, Transition Nursing, I studied about 6 hours every day, including weekends. Just before a test, it would be more than 6. My family support system has helped me survive. My husband cooks, my parents help with the kids. I couldn't have done it if I had tried to work, take care of my family, survive nursing school, and take general education classes. I think it would be impossible. One reason nursing is so time-consuming is that it's a new way to learn. You don't memorize. You take everything you've learned and you make it functional in nursing care."